Welcome back, everyone. Dr. David Amron. I am the host of Lippy Logic at the Lippy Lounge. Welcome. Today's topic is going to be about the roles and goals of liposuction surgery. Obviously, everybody wants to avoid surgery. And obviously, like I've talked in many other segments, prevention is very important to slow the progression of this condition. But still, many times, even with the best prevention, it still continues to advance. And in some patients, it begins to advance so much that they have a lot of fibrosis, and that can begin to affect things and eventually begin to cause problems and damage with the lymphatic system called lymphedema. A lot of patients, it is very important to consider liposuction surgery. And I'm going to say this, in some patients it's really crucial. The patients that are more aggressive, that are moving down that road more quickly, despite the best preventative measures, need to really consider it. When I go through plans with patients, I see patients like that, many times I'll sense that they are hesitant in terms of doing surgery, understandably, and want to do everything preventatively. And many times I've seen patients that have spent years or sort of wasted years trying those things and still advance with things like that. And so it's important to consider liposuction surgery in most patients, really. I'm going to say this also, that despite the best preventative measures, the single most life-changing thing that a patient can do is well done, properly done liposuction for the lipedema. It will make the biggest change in terms of setting it back in its course. That said, you need to take your time and be very judicious about doing that surgery. You need to empower yourself with knowledge, and hopefully the show is giving more knowledge, because knowledge is power, and that reduces the leap of faith and the increasing trust you have about doing the surgery and who you're going to do it with. So let's talk about roles and goals of liposuction surgery. And they're really, it's not that complicated. There's two main goals to liposuction surgery. Number one, the maximum disease treatment and prevention for this disease. And number two, the maximum cosmetic improvement. And they're not mutually exclusive. There's some, I've heard this where some surgeons will say like, oh, it's only for disease treatment, don't pay attention to cosmetic. And really they go hand in hand. They really should, when done properly. I look at it like a spectrum in terms of where somebody is on the spectrum. On one hand, you've got maximal functional improvement, disease treatment. On the other hand, maximum cosmetic improvement. And you have to ask yourself, where are you in that spectrum? For most patients, it's a combination of those things. For a person who can't walk at a stage 4 lipolymphedema, it's obviously more towards functional. For a person who's 125 pounds, that's stage 1, that's not in pain, that doesn't like the look of her legs, obviously it's more cosmetic. But again, the surgery should achieve maximum improvement in both functional and cosmetic. With functional, there are a number of goals. Obviously it's disease treatment, like I mentioned. It's of course fat removal, removing a lot of fat, or maybe as much fat as possible. We're going to talk about in the other segments, how much fat, 5 liters, more than 5 liters, all that stuff. Fat removal is a part of it. Maximum decongestion is a huge part of it. We talk about fibrosis in other segments, what fibrosis is, basically scar tissue in that layer of fat. That is the thing that's really causing a lot of the problems and eventually can cause lipolymphedema. And how well that surgeon knows how to deal with that fibrosis and maximally decongest and release the fibrosis is a huge part of things to improve that lymphatic flow and to help prevent things also. Liposuction should create a proper balance and proportion in an overall person's body so that as they're gaining and losing weight, they're doing it in a balanced fashion. We've talked about that in other segments. It should also respect cosmetic units and create the right type of three-dimensional shape to the cosmetic units. It should create a natural overall symmetrical shape to a person's body. And of course, if it's done properly, you should get an improvement in skin tone and texture. And that is a whole discussion in and of itself, which I will go into in another segment in terms of how the skin is dealt with. With lipedema, you not only have the element of cellulite that's there and the connective tissue, you have that increase with more fibrous tissue. So knowing how to release that fibrous tissue properly and create a smooth surface of the skin and get the best improvement of cellulite is also another very important thing. Bruising tends to improve, going back to functional things. With properly done liposuction, swelling tends to improve also with it. So again, to summarize, liposuction should definitely be considered, honestly, in most patients. Some patients it's crucial. Every patient should get the best functional and disease treatment improvements and cosmetic improvement with the liposuction surgery. I'm Dr. David Amron. This is Lippy Lounge and Lippy Logic at the Lippy Lounge. Thank you so much for tuning in.